Insurance section of the Patient tab allows you to configure insurance information for the patient and add up to 4 insurance companies to a patient's account. To add insurance information for the patient, click the appropriate Insurance tab and then search for the insurance company by using the lookup field. Next, you may enter the policy number. The policy number field should contain the patient's policy number for the selected insurance carrier. When entering the policy number, include any applicable prefix or suffix with the policy number. Be sure not to enter any spaces or special characters, such as dashes or asterisks within the policy number. Next, you may enter an applicable copay or group number and then enter a suffix if needed. The suffix field should only be used if there is not enough room for the suffix to be added in the policy number field and for any special billing situations. The next field you will notice in this insurance section is the relationship field. This is used to identify how the patient is related to the subscriber. Notice that the relationship field will default to self. To enter a relationship, simply select the choice from the drop-down menu. Next is the subscriber field. This is used to identify the policyholder of the selected insurance. By default, the responsible party is set to the patient. If the subscriber is not the patient, you may add them here. To add a subscriber for the selected insurance, you can either search for a person that is already in the system, or you can press the F2 key when the cursor is in the subscriber field. Pressing the F2 key will bring up the subscriber window. When adding a subscriber, be sure to add the subscriber's sex and date of birth, as both are required for HIPAA compliance. After entering the subscriber, enter any activation and expiration dates for the insurance policy. Note that you also have the option to attach a scanned image of the patient's insurance card through the Scan button. Also, by checking off the Authorized Payment box, you are able to confirm that the patient has authorized payment from their insurance carrier to be applied to their balance. Additionally, you may also confirm if a patient's signature is on file by checking off the Signature on File checkbox. The Insurance section also has the ability to enter special billing instructions through the More button. Billing instruction codes are attached to charges to provide additional information or special circumstances about the procedures being billed. A common example for using the More button is to configure codes that tell why Medicare is the secondary insurance being billed. And lastly, through the Approvals button, you will also have the option to enter authorization information for your patient, such as a pre-certification or authorization number, date, or comment. If entered, this information will also appear in the Charges tab for your patient and practice manager. Once you are finished entering your patient's insurance information, be sure to click the Save button below.